Hello, my name is Erin and I am here with Tamara Miller, who is a healthcare provider at UW-Eau Claire Student Health Services. Today on Conversations with Student Health Services, we are going to discuss treatment of upper respiratory infections with over-the-counter medications. So Tamara, how should I treat a fever?
Fevers can be treated with acetaminophen or Tylenol, 1,000 milligrams every 6 hours, as needed with a maximum daily dose of 3,000 milligrams daily. Regular strength acetaminophen is 325 milligrams per tablet, while extra strength Tylenol is 500 milligrams per tablet. Ibuprofen is another medication that can help with fevers. 400 milligrams to 600 milligrams every 4 to 6 hours as needed. One tablet contains 200 milligrams. This medication can upset your stomach, raise your blood pressure, and stress your kidneys if taken too often. Naproxen, or Aleve, is also another medication that you can take for fever. 220 milligrams to 440 milligrams every 12 hours as needed. This medication is like ibuprofen and should not be taken with it.
Can these medications also be used to treat a sore throat?
Yes, of course, acetaminophen, ibuprofen, and naproxen can all be used to manage pain associated with upper respiratory infections.
Cough is another common symptom that can be bothersome with an upper respiratory infection. What can be taken for this?
Throat lozenges, hot tea, and honey may provide some symptomatic relief. Unfortunately, there's just not a great deal of evidence for or against the over-the-counter medications for cough. Dextromethorphan and guaifenesin may have a minor benefit, but both can cause dizziness, drowsiness, and nausea. Due to the minimal benefit and often probable side effects, they may not be worth this cost.
What can be used for a runny nose or a stuffy nose?
Antihistamines and decongestant combinations may be more beneficial than either component alone. This includes Claritin D, Allegra D, Zyrtec D. Common side effects include drowsiness, dry mouth, insomnia, and dizziness. Decongestants alone may offer mild relief. Sudafed or pseudoephedrine is a common oral decongestant. A topical decongestant, such as Afrin, should not be used more than 2 to 3 days. After more than 3 days of use, Afrin can actually worsen runny nose or congestion. Topical decongestants can cause nosebleeds as well. Saline nasal sprays may help and have little side effects.
Are there any alternative therapies that have been shown to be helpful?
Zinc may decrease symptom severity and duration, but requires high doses to be helpful and is associated with side effects. Oral zinc can cause nausea. Zicam or intranasal zinc may cause irreversible loss of smell. Other alternative therapies such as vitamin C and echinacea have not been shown to be helpful in large clinical trials.
What about an antibiotic? Would that help?
Antibiotics are not helpful for most upper respiratory infections. Most infections are caused by a virus and resolve in about a week.
And at what point should I consider calling student health services?
Well, due to concern for COVID-19, students are encouraged to call Student Health Service with any new, persistent, or unexplained symptoms such as fever, cough, sore throat. Students will be triaged and scheduled for a COVID-19 test or appointment if needed. Students can contact Student Health Service by calling 715-836-5075.
All right, thank you for letting me know.